It takes a lifetime of you breathing through your mouth and doing the wrong things with your tongue, having the wrong posture with your jaws. All of these things build up over time, and eventually people develop sleep apnea. So it starts with mouth breathing during the day. If you're mouth breathing during the day, you will always be mouth breathing at night. These dentists who look at modern people's teeth and modern people's jaws, and they compare the skulls of ancient people, and they can see enormous differences in the way the jaws are structured, and have all of their teeth. They have their wisdom teeth, they have broad jaws, really strong mandibles, fully developed maxillas, and everything's forward. They have room for all their teeth, and everything. They have straight teeth. It's amazing. So there's something going on with our modern diet and our modern lifestyle that's leading to these dental changes and breathing changes, and then that affects our airway, and it's all connected.
Well, Sarah Hornsby, thanks for being here on High Intensity Health Radio. I'm super excited to talk about myofunctional therapy and really sleep disordered breathing, airway development. I think we were talking offline. A mutual friend of ours, Mark Brehenna, really opened me up to this topic. And sleep is so popular for its restoration right now in terms of how sleep quantity, sleep duration, and lack thereof is linked with disease from obesity, diabetes, metabolic syndrome, and so forth. But you're bringing and highlighting a new aspect of sleep dysfunction and this airway dysfunction. So let's take a deep dive into kind of the airway, and we're talking offline about the epigenetics of jaw development and things that I've never heard before.
Yeah,
I think people
it's
should know
fascinating.
about.
I would say probably from that epigenetics perspective, we have to really step back and say, well, what is myofunctional therapy and what am I even doing? So that would probably help make sense with the rest of it. If you want, I can explain that. Yeah, so myofunctional therapy is an exercise-based treatment. I basically teach 4 things. I teach lip seal, so I want my patients to have their lips resting together. I want my patients to all breathe through their nose. Nasal breathing is the most important thing I teach, and I always tell my patients that breathing through their nose is the #1 priority they have when they work with me. So you have to figure out how can you breathe through your nose, even when it's stuffed up, even when you're having allergies. If you have a physical reason why you can't breathe through your nose, we need to work through that. So that's how I explain to them, your nose is so important, we have to use the nose. I teach tongue position, and I teach swallowing. So everyone who has an open mouth resting position, which is probably the symptom of all the symptoms that creates the problem. So if you can't breathe through your nose, you're going to open your mouth, then you have a low resting tongue, and then this cascade of effects happens with your health, and then it eventually gets to your sleep. So hopefully, does that make sense?
So that's a root cause. So why is it, you just kind of explained to it. So it's really the tongue positioning that is dysfunctional when you're breathing through your mouth. That's the tipping point, is it? Exactly.
So when you can't breathe through your nose, you have to breathe through your mouth. And our bodies are so good at adapting that we will just revert instantly. I think it's something like if you have a 10% more difficult time breathing through your nose, you'll revert to breathing through your mouth. So instantly our body wants to do that. When you open your mouth, even just a tiny, tiny bit, in kids it's really obvious. You can see that their mouths are just hanging open. They don't have those social stigmas that they attach with having a mouth hanging wide open. Adults might be just a millimeter, just barely parted lips. When your mouth is open, your tongue drops low. And when our tongue is low, that's where it affects the development of our maxilla and our jaws and our facial structures. And that's what has an impact on the airway.
And this becomes particularly problematic for that deep restorative sleep when this happens, right?
Yes, so when you're breathing through your mouth all day, that is creating problems on a lot of levels. So our noses are meant to moisten air, warm air, clean air, and we're meant to use them. So we should be breathing through our nose all day. Also, there's nitric oxide that when we use our nose is really important, and I know you have a book about the microbiome, right? So nitric oxide helps with the microbiome inside of our nose, and it helps us have healthy, it allows the bacteria in our nose to work how it should. If we breathe through our mouths, we're automatically bypassing that nasal breathing importance of cleaning and moistening and all that stuff that has to do with the nose. So it really compounds, I would say, the sleep issues that come from breathing through your mouth and not using your nose. They take time in most adults. Some kids that have obstructed airways from a young age, like they have large tonsils and they're only a year old, that's a completely different scenario. But for most adults, it takes a lifetime of you breathing through your mouth and doing the wrong things with your tongue, having the wrong posture with your jaws. All of these things build up over time, and eventually people develop sleep apnea. So it starts with mouth breathing during the day. If you're mouth breathing during the day, you will always be mouth breathing at night. When you relax and you go to sleep, if your mouth's open during the day, it's always at night. Then that leads to snoring. Snoring leads to something called upper airway resistance syndrome, and that's like a precursor to sleep apnea. So sleep apnea is like the end point, and some people never get there. I can't say for sure that if you're a child with your mouth open and you grow up into an adult with your mouth open, that the end point is sleep apnea, but I would put money on it.
Right.
So it probably will happen, but I can't, say that everyone will. So
my mind's racing right now, many different things, and I'm being very conscious of
huge topic, so
tongue positioning. But this upper airway resistance syndrome, we were talking offline how that's more common and pervasive in women, because when we hear the word sleep apnea, we think of the big belly, white middle-aged male with a big fat neck, but we're looking at sleep apnea that's covering much larger, and the sleep disordered breathing covering a larger spectrum. And this upper airway resistance syndrome, you found, or you were telling me that it's common in women, like postmenopausal, premenopausal women, right?
So a lot of women that I work with, and I've seen this over and over again, and I would say most of my patients are women in their 30s, 40s, and 50s, because this tends to be an age group where we're interested in our health, and we can't figure out why. When I ask the doctor, they say, that doesn't matter, just ignore that mouth breathing thing. But it happens in women, and I'm not exactly sure why. It doesn't have to be related to weight. It doesn't have to be related to gender. The main thing that they're finding is that it's people with small airways. So you can have a small airway from having improper jaw development, from breathing through your nose, or from not breathing through your nose for years and years. You can develop that resistance. It's not quite obstructive, which is the piece obstructive sleep apnea. So it's like a precursor to that obstruction, but it's creating less oxygen, or it's less oxygen is getting to your brain and to your organs and is in your body pretty much. So
that does make sense. So maybe this is a nice time to kind of weave in that developmental epigenetic component, because the small airway, there's many factors going on here, both environmentally, and I think you mentioned environmental toxins, but also foods and early life exposure to hard foods and stuff like that. So small airway, just to set the groundwork for you to take a deep dive, the small airway is linked to sleep dysfunction.
Yes,
and sleep disordered breathing, that's linked to heart disease, diabetes, obesity, every disease we can think of. And it takes a lifetime to really, in some people, to develop these diseases. So if we're looking at root cause resolution, the whole purpose of this podcast is trying to get at that. This small airway or airway dysfunction is a big issue, right? So talk about the insults, the bad guys here that contribute to this small airway.
Well, a small airway can come from, the biggest one is enlarged tonsils and adenoids. So this, I would say, relates mostly to kids, but what we're finding is that kids have allergies. Adults have allergies too, but in young children, this is very important because it affects the development of their face. So if they have large tonsils and adenoids and they're allergic to something, we don't know what, is it food, is it pollen, is it dust in the house, is it the pets, we don't know. And a 2 or 3 year old can't tell you. So it starts from a young age, most of these airway development things. And a lot of people, myself included, don't want to have surgery on a 2 or 3 year old to take the tonsils and adenoids out. But that's pretty much the go-to thing. So it's tricky, and I struggle with this all the time. I walk parents through it all the time. But what do you do with a 2 year old who has giant tonsils and adenoids and we don't know why? So we can do allergy testing. We can try to do a number of things, but that's the sticking point is, how do we change that? So when the tonsils and adenoids are enlarged, we revert to breathing through the mouth. We move our heads forward, our shoulders roll forward, we don't breathe as fully as we should, and our jaws develop differently. So it really mostly has to do with growth. So you take a child who can't breathe through their nose, and as they grow up, all of these developmental things are happening to their jaws, their skull, their neck, their shoulders, their chest even. So it's something that I think is so overlooked. Nobody's really looking at it, you know. I mean, there are a few dentists out there, like you said, Dr. Mark Brahenna, he's a really good one. He's looking at this stuff, and a lot are, but most aren't. So it definitely starts from a young age, and it happens, you grow up with these breathing and airway issues, and that's the number one reason. We could get into other things like tongue tie, and that's a different story, but we can talk about that if you want.
Sure. So let's go back to the adenoids and the tonsils. Would you recommend, if they're enlarged and that contributes, that's the root cause, the tipping point that's causing all this dysfunction, I know surgery is invasive and all that, but would your recommendation generally be just get rid of them?
In older kids, I say, you know, there is a chance that you can reduce tonsil size naturally. Young kids are, honestly, I tell people I don't always have the answer. We need to get doctors on board. I say quite a bit, I'm not a doctor. There are people who are doctors that specialize in these tough cases. I'm hoping I can guide you to make the best decision, but sometimes in that case, if it really comes down to your child is not growing optimally because they're not getting oxygen to their brain and to their organs, then a surgery might be necessary. But personally, I don't want to have any surgeries. So I understand when people come to me and they say, I don't want, my 5-year-old has giant tonsils, but I don't want to have them removed. Then there are breathing techniques you can do. I've heard of people, you know, with acupuncture, reducing tonsil size, and aromatherapy. Sounds really interesting, but there are alternative ways to reduce the tonsil size, and the main way is to just breathe through your nose. But how do you tell a 3-year-old to breathe through their nose when it's really difficult? An adult can kind of force their way through that, and the more you use your nose, the easier it gets. So it's easy in older kids and adults. It's that young age group where nobody has answers. We know it's a problem, but it's really hard to treat. Yeah,
there was a Dr. Levy who I heard speak, and he wrote a book about the oral microbiome and so forth, and he talked about how tonsils really are inflamed and infected and leak bacterial constituents throughout the body, and then that leads to heart disease and plaque formation. So his advice is go to an ENT, pretend that you have every symptom under the book so that you can get them removed. And
really?
Yeah, so he's a huge fan. He's like, look, I'm not a fan of interventions and surgery in most cases, but just get the tonsils out.
Interesting.
So he has a great book. I think it's called Toxic Tooth, I believe. Maybe it's Toxic Teeth. I can't remember. I haven't read it. But anyway, he talks about that in the book. So if people want to learn more about that and the tonsils and the inflammatory component, that could be another resource, and maybe you'd be interested.
That's something I had never heard, and that is really interesting to me, because I have a lot of people who say we don't want to take these out, and I do recommend at some point they might need to come out, and I always feel a little bad saying that, but you know, if it really is causing developmental issues in your child, then it's time to just think about the surgery.
Right.
But speaking of the oral microbiome, the problems that are caused by breathing through your mouth also affect our oral microbiome and the bacteria that can lead to tooth decay and gum disease and all these bad things from breathing through your mouth instead of breathing through your nose. So it's like it covers so many topics.
Right. And then that ricochets into the gut microbiome, because everyone is so enthralled with the gut microbiome and the 100 trillion bugs, but it really starts here, like you're talking about the nose microbiome and then the mouth, because if you have dysfunctional bacterial species there, you're going to swallow them, and that will affect not only the immunology, but also the microbial aspects of your entire alimentary canal. So really important discussion that we're having here. And so you mentioned offline too about an anthropologist who is I think a doctor who is working with anthropologists to look at historical jaw, tooth, airway development. Share with us that info.
Yeah, so there are a few dentists. Actually, the most well-known I would say is Dr. Kevin Boyd. I think he's located in LA or somewhere in California, and he's doing research for the first time ever, teaming up with anthropologists. So most of the time, a dentist and an anthropologist would never cross paths. Why would they, you know? And so it's fascinating when these dentists who look at modern people's teeth and modern people's jaws and all the modern issues that go along with gum disease and tooth decay, and they compare the skulls of ancient people, or people not even that not that old, 400 or 500-year-old skulls, and they can see enormous differences in the way the jaws are structured. And for example, all of those older ancient people have all of their teeth. They have their wisdom teeth. They have broad jaws, really strong mandibles, fully developed maxillas, and everything's forward. They have room for all their teeth, and everything. They have straight teeth. It's amazing. So there's something going on with our modern diet and our modern lifestyle that's leading to these dental changes and breathing changes, and then that affects our airway, and it's all connected. We can't get around that fact.
Right. So Weston A. Price was one of the first ones to talk about the teeth in general, but this is the first time that I've heard about, jaw and airway. So I think that's really important and obviously related.
It's definitely related.
Before we talk about all the good stuff and the remedies, are we missing any other causative issues? We've talked about mouth breathing and
a tongue tie. So there's going to be, when I work with people, I can connect their myofunctional issues, which is really what I screen for. I can trace that back to usually about 4 main things. So the first one is, we're all born with a tongue thrust swallowing pattern. That's an infantile swallow that we all use to breastfeed. For some reason, we don't always know why, that swallowing pattern does not get grown out of. We don't revert to how we should. So that's one cause, and that's kind of the most, I would say, mysterious of them all. The second cause is an airway or an airway issue. So tonsils, sinus issues, just being sick a lot. Anything that causes nasal congestion will contribute to a myofunctional problem, which can lead to these airway problems we're talking about. The third cause would be thumb sucking. So children who suck their thumb longer than they should. If someone is 3 years old and they're sucking their thumb, I'm not too concerned. But if it lasts to, age 5, 6, or 7, that's when it really starts to not only affect the dental development, but the development of the muscles and the tongue position. So that's a key important piece that a lot of parents don't know. They just think, oh, it's affecting their teeth, but we'll get braces. They're not thinking about what it's doing to the tongue and the lips and the muscles and the development of the mouth. The fourth cause is a tongue tie. So tongue ties are fascinating, and I can go more in depth about that.
Yeah, I think a lot of people, it's a new topic. The only reason I know anything about it, my friend Ben Lynch is really into methylation and epigenetics, and I know there are some epigenetic aspects that contribute to tongue tie development and so forth. So how do you identify a tongue tie, like visually, and then what does it do? How does it cause dysfunction?
So we all have something called a frenum, and that's an attachment of skin or tissue, whatever you want to call it, underneath our tongue. And in some people, that's too short. It shouldn't inhibit the movement to an extent where you can't use the very tip of your teeth to reach to the back side of all your last molars. So if you do it right now, you can kind of use the tip of your tongue. If you can't reach it to the back side of your teeth, the first problem that's causing from a dental perspective is you can't get the food out of your teeth. So that's going to put you at a higher risk for developing tooth decay. So we don't want that. A tongue tie is usually noticed in babies because they can't breastfeed very well. So that's the first place it's noticed. For those babies that just, no matter what the mom does, no matter what the doctors recommend and the lactation consultants try to do, if they can't breastfeed, it usually has to do with a tongue tie or a lip tie. And there are a few doctors who are really looking at this stuff. A good tongue tie specialist who's near us in Portland is Dr. Bobby Gahary, and he is somebody that he has a great blog, and he's really active on, there's actually an adult tongue tie support group on Facebook, and he's pretty active on there, and there's a baby tongue tie support group too. So I log into those and kind of check out what are people talking about, what are people asking, and it's a really good way to just see, wow, this is a real problem. But so the first instance where it can get noticed is breastfeeding, but sometimes people are tongue-tied and they breastfeed fine. So the next area is speech. So a lot of people who are tongue-tied have speech issues, and it can be a lisp. In my experience, it's R and L sounds the most for kids when they can't, pretty much the tongue has to kind of elevate like this to make a R or L sound. And if the tip is too restricted, if it's too connected to the bottom of the mouth, they can't do that. So if they don't have any speech issues, though, it might get missed. So I see plenty of adults in their 40s and 50s who are severely tongue-tied and no one's ever noticed. So, then people say, well, why does it matter? In most cases, in people who are tongue-tied, they have a lot of jaw pain, and they definitely have airway issues. So there you go. It relates back again.
Yeah.
So.
And so the tongue tie, just to kind of, for people that want to know the mechanism, so that's preventing the tongue from sitting on the top of the mouth where it should, and then so it's fostering breathing through the mouth?
Yeah, so when I evaluate my patients, I'm screening them for two things basically. A low resting tongue is the overarching thing, but you can have a low resting tongue because of a tongue tie or because of a tongue thrust. And a tongue thrust is basically just when your mouth is open and your tongue learns to lay down on the bottom of your mouth. Your tongue should be filling your entire mouth, your entire oral cavity should be taken up by your tongue. It shouldn't be that, you know, your tongue is down here and you have all this kind of space between your tongue and your top jaw.
I see. Interesting.
Pictures help describe this, but
that does, yeah. So if there's like corollary, that word, I have a hard time with that. I think I have a mild tongue tie.
Oh, you think so?
So you mentioned R's and L's. You know,
Yes.
those are. And my daughter has a hard time with S's. So I don't know if that's related or unrelated or
Can be.
not. But so let's talk about the treatments, you know, and stuff like that. Obviously, you do an assessment. You want to see where. In an ideal world, people would see someone like yourself, a myofunctional practitioner, right?
Yes.
Let's say someone's driving right now, we're at the gym, and they're like, gosh, I just want to kind of see if this can improve my health. Should they be more cognizant of their tongue position? What if they're breathing through their mouth? Like, what are some just at-home stuff people can do?
So the first thing you can do is start to develop awareness around your mouth. And this is something that is the hardest to teach people, but if they can teach themselves, they will help themselves a lot. So think about what your lips are doing. You know, are they resting together? Are they parted? So that's the first thing you can think about. Think about the tip of your tongue. These aren't natural things for us to think about. These are things that you have to really concentrate and practice thinking about. So first think about the tip of your tongue. Where does that rest? Is it, you know, on the roof of your mouth? Is it behind your upper front teeth? Is it behind your lower bottom, you know, your bottom teeth, like below them? Is it between your teeth? And then you can kind of move further back and think about like the body or the bulk of your tongue. Is that high, touching the roof of your mouth? Is that somewhere in the middle? Is it low? And if you can develop an awareness about where your tongue is sitting inside your mouth and what your lips are doing, and are you breathing through your nose, that's the first step. If you notice that your tongue is low, your mouth is open, and you can't breathe through your nose, then you definitely need myofunctional therapy. So,
right.
Yeah.
So little reminders like on your iPhone or something, or little Post-its around, like have any tips that you share with?
That is something I recommend to people, but that awareness is something that first you have to get the awareness, then you have to try to change it. So I teach people exercises on breathing through their nose, on how to get their tongue to their palate, because if you're, you know, in your 30s, 40s, 50s, whatever age you are, and you've had a low resting tongue your whole life, the muscles really don't know how to work. They don't know how to go where they should go. They don't know how to go up to your palate, and then they don't know how to swallow correctly. So that's why I have a job.
Right.
Because if it were so easy, we would all just say, oh, this is a problem, I'll fix it on my own. And to an extent, people can teach themselves to close their mouth and breathe through their nose. The hardest part is getting the back of the tongue to elevate to the palate. That's something that it really takes activating new muscles that you've never used. And that's what I teach.
Right. People are probably sore after a little bit, or they just...
It depends. I mean, some of the exercises can be really tiring. I've had people say like, oh, I feel like I got, you know, it's like a workout for my face, or, you know, like the floor of my mouth or my neck. So a lot of people do experience that,
That's pretty awesome. So when you go in public, you probably look around and go tongue tie, or mouth
oh gosh,
breather.
I can see it a lot.
challenging.
Yes, and even people who know me, my boyfriend included, you know, he'll say, we'll be watching TV and he'll say, oh, I think that person needs myofunctional therapy.
Oh my gosh, yeah. That is so funny.
Yeah, it's once you know the signs and symptoms, you know what to look for. So I can tell looking at people's facial structure and their jaw structure. I can pretty much guess if they have these myofunctional issues. I'm pretty sure.
Yeah.
So
some other tools that are out there, obviously we want people to go to practitioners like yourself, but there's the Myo Brace and there's other tools that are available. What are your thoughts on some of that? So if people want to get searching on this, there's like a whole plethora of things.
So I work with a lot of orthodontists because many people who come to me have orthodontic relapse, which is when your teeth move. You know, you had straight teeth when you were a teenager, you got your braces taken off, and then over time your teeth have drifted and things have changed. And one of the culprits for this change is an open mouth and the low resting tongue and all these things I'm talking about. So a lot of orthodontists say, okay, you're an adult, you want braces again, but your tongue is an issue. You need to go work with a myofunctional therapist like Sarah, and she will teach you how your tongue should rest inside your mouth and how to change your swallowing pattern so your braces can be more effective. And then hopefully the practitioner or me, whoever you talk to, can point you in the direction of an orthodontist who does what we call, or who uses a functional appliance, which is something that I only refer to dentists and doctors who use functional orthodontics. So there's a term called orthotropics, which focuses on facial development and facial growth rather than just straightening teeth. And that's, I think, the crucial aspect that gets missed, is that the tongue has a huge role in the tooth position, which should be obvious.
They share the same ecosystem, my gosh, yeah.
Yeah, you'd think we would all look at these things, but I know from my own dental education, we didn't really look at the tongue. So, yes, the MyoBrace is a good appliance. I love an appliance called the ALF. I don't want to mess up what it stands for, but I think it's the Advanced Light Wire Functional Appliance. Okay. And it's meant to be like braces. It goes on the inside of your teeth, and it's just a wire, and it's meant to work with your body. So it's supposed to be gentle, it moves your teeth, it expands your palate, it does all the things that we want, but it's not forcing things into positions that the body doesn't really naturally want to be in, if that makes sense. So I'm a big advocate for functional orthodontics. Yeah,
what I was going to say was about the tongue tie and the breastfeeding thing, but so many women now are not breastfeeding. So if you're not breastfeeding, you wouldn't really catch a tongue tie until later in life when there's speech stuff, and then by that point there's been this dysfunction for a long time. So I think that's an important point for new mothers. I mean, to encourage, again, here we go back to nature. What do you think? Breastfeeding, my goodness, that we should be promoting this, obviously. But you were talking about some of the hereditary and then also epigenetic aspects or developmental.
Yes, a tongue tie is definitely hereditary. So when I see a child who's tongue tied, I will ask the parents. I'm like, you are probably tongue-tied as well. Why don't you open your mouth and see if you can do these things that I'm making your daughter do? And usually the mom or dad is tongue-tied as well. So I'll see if I can remember the gene, but it's there's a specific gene it's connected to, MTHFR.
Yeah.
It's a midline dysfunction gene. I think it's responsible. Also, the mutations of that gene are responsible for spina bifida. There's a ton of things that can come from it. Cleft palate syndrome, a few other big deals. One of the more minor issues that comes from a mutation of that gene is tongue tie. And it runs in families, and it's I don't know about the epigenetic aspects of a tongue tie, but as far as I can tell, it's just a genetic mutation, and it's considered like a minor birth defect, I guess. You want to call it that?
Yeah. Well, that friend that I was telling you about, Ben Lynch, who's been on this podcast before, the estimates of the MTHFR single nucleotide polymorphisms, aberrations in the genes, are between 50 and 80% of the population. So we're talking about a lot of people here.
Yeah.
And then moreover, since MTHFR is involved in methylation, there's a plethora of environmental toxicants that affect or perturb methylation that lead to epigenetic issues. So,
I don't even know about that, but
interesting.
I think it's fascinating. Yeah. The tongue tie issue is really tough for us as healthcare practitioners to measure because it's very objective. So one dentist might look at somebody and say, oh, you're not tongue-tied, you're fine. Another might say, wow, you're severely tongue-tied and you need surgery. So we don't have a very good standard of measurement because everyone's tongue looks so different that unless it's super obvious, like I'm talking about, I wish I had a picture to show, but the frenum on some people actually attaches to the very, very tip of the tongue. I've seen it twice in my career, so it's not really common. But the variation from a tongue tie can be something from, a very moderate or very mild restriction and, limited movement to all the way up to like fully connected tongue to the floor of the mouth. So the range in there is important to consider. For me, if people if they can do the functional things that I want them to do, like open their mouth wide, elevate their tongue to the roof of their mouth, touch their back molars. If they're functional, I don't recommend a surgery. But if they can't do a few functional things, and when I say functional, I mean basically, I need all my patients to elevate their tongue and keep it in the roof of their mouth. I need them to be able to clean the food out of their teeth. If they can't do those functional things, then I say,
Makes sense.
you need a surgery. And it's a very minor, easy surgery. It's just a snip or a laser under the tongue, and it's done all the time. So, I'm very familiar with it, and I recommend it all the time.
Yeah. So let's kind of finish off with, we talked about sleep disordered breathing, and I've been doing mouth taping at night. I don't know, you're familiar with that?
Yeah, I teach it, yeah.
Yeah, okay. So I found that is so amazing. Again, this is another tip. I want to give credit where credit is due. Mark Brahenna totally recommended that to me. He's a past podcast guest and a mutual friend of ours. So it was really kind of interesting at first. You're like taping your mouth shut, and it kind of creates a little bit of paranoia. And sometimes like some nostrils are like, clogged or closed or whatever. So the natural inclination, if you're clogged in your nasal cavity, is to breathe through your mouth. So what are your tips and solutions there? That's kind of a big...
Well, I have one of my foundation exercises is an exercise that I teach people how to unblock your nose. So it's a Buteyko breathing technique. That's Buteyko. I think it's a method that comes out of Russia or Ukraine or something like that, and it's gaining ground too because it helps with sleep apnea and asthma. But that breathing technique, basically, you kind of hold your breath, you deprive yourself of a little bit of oxygen, and the body, like I said earlier, wants to work correctly. So if you can't breathe through your mouth and you hold your breath and you force yourself to only breathe through your nose, your nasal passages will clear. And it takes some practice. I have a really popular YouTube video. I don't know how it got so popular. I don't think it's a very good video, but it has like 300,000 views.
Good for you.
Just this one video about how to unblock your nose. So I teach that exercise, and it works really well. So also, like I said in the beginning, when I work with people, I say your number one priority is to breathe through your nose. So if you need to use a nasal spray, I have some natural ones that I recommend because I prefer natural methods. But nasal spray, medication, hot tea, steam, neti pot, anything you can do to get that nose clear is so, so important. So
yeah, this has opened up a new level of awareness for me because I noticed the different foods like dairy and alcohol, red wine, just a small amount because I don't really drink much alcohol. Totally clogged up my nose, and then so I had dysfunctional sleep, and then I felt terrible the next day. And so for a lot of people, if you're not aware of that, you're not aware of your nose and mouth breathing and stuff, you just go through life and think, oh, these foods are okay, I can do bread, I can do gluten, I can drink a bunch of alcohol, and you don't realize how it's affecting your health. So I love all these little tips that you're offering, Sarah, because it gives people that next level awareness. And then once you have a really good night's sleep, you're like, oh my goodness, this is totally different, because your dreams are more vivid, you wake up with more clarity, more intuition, more creativity. How do you feel about a sleep study or sleep cycle, using those apps to track sleep and monitor this?
So a lot of people are now finding me because we've had a few research studies coming out over the past 5 years talking about oral exercises being something that can help with sleep apnea. So I'm finding a ton of people, they connect with me online and they say, I have sleep apnea, I hate wearing this CPAP machine, I had a sleep study done, which everybody needs a sleep study if they think they might have sleep apnea, that's the way you know. So they're finding me because they want to learn how to do these oral exercises that, to me, it seems pretty obvious. It's like any other muscle in our body. If we have a firm, toned throat and tongue, we're not going to have a flabby, flapping airway, right? So we aren't going to snore at night. And a lot of the people that I see may start off with a high sleep number in the 30s. So for anybody who doesn't know about sleep apnea and sleep scoring, I can explain that.
Sure, let's do it.
The apnea-hypopnea index is a measurement that the sleep study will tell you, and that's how many disturbances or fully stopped breaths you have per hour. So if you have a 35, that means you're stopping breathing 35 times per hour per night, which is insane to me. I think no wonder you feel tired and fatigued and like foggy and you can't function in your daily life. So the CPAP is designed to help. Basically, it stands for, CPAP is continuous positive airway pressure, and it forces air into your mouth, which isn't always pleasant for a lot of people. Right. So a lot of my patients learn exercises, learn how to strengthen and kind of take control of their own health, which I'm a huge advocate of. So they practice these exercises. They have to do it daily. 5 or 10 minutes a day, not a big deal. But for people who have sleep apnea, it is a continuous thing, like going to the gym. For people who just want to change tongue posture, that's a different thing. But they will reduce their numbers quite a bit. So maybe they go from 35 to 25, which then might allow them to use a dental appliance rather than a CPAP machine. So, getting that lower, that reduced sleep apnea number, I always want to track that, because if somebody comes to me and they have a 30, I want them to get a sleep score usually a year later. I recommend, after they've been doing exercises and changed their habits. I want to see that number drop. And that's a big deal, because CPAPs and a lot of these treatments don't claim to reduce the number. And I think these oral exercises and the research that's coming out is why people are starting to look at myofunctional therapy. So
right. So dropping that number is a great way to quantify the benefits and kind of the results of these exercises. But going back to like the mechanism of action, or how that machine works, it's not a root cause resolution, because
no, it's not.
You talked about the nitric oxide or nitrous oxide, the changes and the benefits of breathing through your nose and how that affects the oral nasal microbiome, right? So if you're just slamming air down your throat, you're still going to have the perturbations in the microbiome, I would imagine.
Yes, it doesn't. I mean, it keeps people alive, basically, because you can die from sleep apnea if you don't breathe enough. I mean, people have severe sleep apnea and just don't wake up. That's the scary thing, and that's why people are, doctors and dentists are starting to think we need to start paying attention to this. It's a life or death thing. It's not just like, oh, I'm snoring. So those devices they basically force air down your airway to open it up. There are some nicer ones. There's a BiPAP and a VPAP, and those are more regulated, and they can put the air in more nicely. But a lot of people get sore throats. They have problems with the pressure on their face, and these masks, they're pretty tight, and people get blisters on their skin, and so it's not a very pleasant thing to have to wear every night. And I try to help a lot of my patients who have sleep apnea figure out how to make their mask more comfortable, how to adjust the humidity on the machine, things that they might not have been told by their doctor or the assistant who gives them the device. And I've talked to people who said, oh, I didn't know there was humidity I could add to this. So I try to help people with these machines and these devices they've been given, and try to help them in every way I can with sleep apnea. Yeah,
and I travel a lot, for work and doing these podcasts and stuff, and I see a lot of sleep apnea machines going through the X-rays at airports.
Interesting.
Yeah, and I didn't really notice that in years past, so I think it's definitely on the radar for general practitioners, internal medicine docs, and so forth. But just to kind of round off this discussion on sleep apnea, Mark Brahenna, a mutual friend again, he says, if you're grinding your teeth and if you're snoring, you have mild sleep apnea, sleep disordered breathing. Yes. So a spouse can tell you if you're a snorer or not, right? Or you can look at your teeth and have a dentist tell you if you're a grinder. So if you're grinding, he says that's you in that sleep that mild hypoxic state where you stop breathing and you're grinding, trying to get air.
Yes.
So for me, I was, my retainers suggest that I'm a grinder, right? So that's what got me, really interested in wanting to spread this message around to a lot of people.
Yeah.
So Sarah, let's kind of finish off. What messages would you say, like we were talking, there's a lot of books like Ariana Huffington and Sean Stevenson. There's a lot of books about sleep right now, and everyone's promoting sleep hygiene and getting the blue light blocking glasses and all that stuff, which I think is really important. But I feel like we're kind of missing the forest through the trees a little bit and not talking about this airway. So as a kind of parting words of advice, what would you suggest?
I would say the best thing you can do is start to ask those questions about awareness, because if your mouth is open during the day, chances are you will at some point develop these sleep issues. And that is, it doesn't matter if you dim the phone, if you go, stop watching TV, if you do all the right things, put lavender on your pillow. If you have a physical problem with your breathing and with your oral anatomy and the way your mouth rests, it's not going to matter. All those other things that you do are more like the icing on the cake. This is like you have to get to the root problem. If your tongue is resting low and you're not breathing through your nose, it sounds like such a simple thing, like why would we even need to think about that? But if you're not doing that, that's a big deal. And I would say monitor yourself and your kids. You can see it in kids much more easily than in adults. So check and see if they're, when they're watching TV, looking out the car window, listening in between conversation, see if their mouths are open. and notice in yourself. That's really the best thing you can do.
Yeah, I've been more cognizant of it as of late, but my daughter, she's 4 years old, mouth is wide open first thing in the morning, and so she's all clogged up, so we need to set an appointment and talk with you about that. But this is kind of off a sidestep a little bit. One reason why I think I open my mouth sometimes, and why other people do too, is if you're always, this is what I feel like, if your mouth is closed and you're breathing through your nose, you look like mad, like upset, and so it's kind of like inviting to smile, and then like you said, if your mouth's open, it's the least path of resistance, right? So you're naturally going to breathe through your mouth. So how, any tips for people like...
I'm thinking about it right now because I'm smiling and I'm breathing through my nose, and I think as long as you're doing that, you're fine. And this is mainly, I mean, think about what you're doing when you're driving and you're by yourself. It's not social. When you're on your computer, conversation is a harder thing because obviously you can't keep your tongue in the right place in the roof of your mouth and talk at the same time.
Right.
So when you're talking, eating, in conversation, these are times in between your normal resting position. So don't worry too much about that.
Okay.
But when you're by yourself and you're noticing, oh my gosh, my tongue is down low in my mouth, I'm breathing through my mouth, that's when you really have to pay attention. Yeah.
Okay. We forgot to talk about swallowing and chewing.
Oh, yes.
Yeah, any tips there? I mean, as we can.
Yeah, so swallowing is where the whole word tongue thrust comes in, and if you're researching online for myofunctional therapy, one of the main terms that comes up is tongue thrust therapy, or do I have a tongue thrust? Because like I said, that low postured tongue is what changes the way the muscles work. So the tongue will push forward during each swallow, and in kids this really shows as kind of messy eating. So you can tell if a child has a tongue thrust, not just by are they breathing through their mouth, is their mouth open, but imagine trying to chew and swallow and eat with a clogged up nose or something pinching your nose. So a lot of times these kids don't have bad manners. They're trying to breathe and eat at the same time, and food's going everywhere, and that's just how it looks. In adults, sometimes that's compensated for, and people will hold their breath while they eat. And that's something that, in order to look polite, that's not very good for us, to hold your breath while you chew. And I've heard it so many times that I'm surprised it happens, but not anymore, I guess. But your tongue, rather than going forward, it should go up and back when you swallow, and that's a harder one to correct. You can kind of say, I'm going to put my lips together, I'm going to breathe through my nose, but to change your whole swallowing pattern is a tough one. I would say just give me a call.
Yeah, that's CrossFit for the tongue.
Yeah,
right?
it is. It's much harder.
Yeah. Oh my goodness, that's amazing. So we have 3 final questions, Sarah, that we ask every guest on the podcast. If there was one herb, nutrient, botanical, or whole food that you just couldn't live without, and maybe you recommend your clients, what would that be and why?
I love lavender. I have lavender lotion. I love the smell of it. I think it's really relaxing and peaceful, and it's supposed to help you sleep better. So on the topic of sleep, I would say, put lavender in your room, put it on your pillow, use it. I think it's good for it. It's just it's a beautiful scent, and so I would say that's it.
That's awesome. Yeah, I make lavender tea at night. So get the whole bulk lavender from like Whole Foods or PCC, a local market, in a French press and poured in there with chamomile. It's really amazing for
Sounds
like a
good.
nighttime tea. That's
relaxing too. Yeah.
Exactly. Yeah, there's some anti-anxiety effects with lavender.
Yes, I've heard that.
Yeah.
So it is supposed to be soothing and calming, and it's more than just, oh, I like the smell. It's, there's real things I think it's doing. Yeah.
That's really funny. So we want to get to know you a little bit more, Sarah. So what's your morning routine? We know successful people and practitioners have like a preset couple hours to themselves, meditation, tai chi, yoga of sorts. What do you do in the first couple hours every day?
I'm not an expert at this, but I do try to meditate. So I was really good when we were staying in Thailand for a while. I had an awesome morning routine, and it was the best thing ever, because starting your day off right really influences the rest of your day. So normally I would go make some coffee. I do drink coffee. I know some people think, you shouldn't have coffee and then meditate, but for me it's kind of like that. I would sit outside, kind of just wake up, drink my coffee in the beautiful paradise where I lived, and then I would go meditate. Usually I try to do it for 20 minutes. If I can do longer, great. If I can't, then that's okay too. I try to journal as well. So I usually take about an hour between just journaling, getting my thoughts out, any ideas that have come to me over the night. and then meditating. Those are ideally how I'd love to start every day. It doesn't always happen, but especially with traveling a lot, changing routines can be tough for the morning routine.
Exactly. We were in Asia and Indonesia, and so it was really conducive to having a calm morning, no Wi-Fi, and then beautiful Bali coffee, and so we would do that, meditate, and so that really got me into the habit. And so when you do that consistently, I think it's nice to learn something on vacation, like a relaxation habit, whether it's yoga or meditation, and try and bring that back into your busy everyday life with kids and work and juggling priorities. So
have you been able to?
I have, and like some days, but I just make it a priority, like I make it working out or eating healthy or whatever. It's like you have to incorporate it into your lifestyle, and even if it's stressful to fit it in, I try and fit it in anyway, because if you go multiple days without it, you just really lose it, and it's hard to get back.
Yeah, it is, and I'm actually in that position right now because I was explaining to you earlier that we have been traveling quite a bit. I've spent the past 2 years living in Australia, Thailand, and New Zealand, on and off coming back to the US. But when you're there in that perfect environment and you feel like you're on vacation, sometimes it's easy to start something like that, but continuing it is so important. So I got about, I would say, in Australia and Thailand, about 6 good months of just really meditating a lot and doing that routine. And now here, I'm trying to figure it out. We've only been back here 2 weeks. So.
Oh, is that right?
Yeah.
Oh my goodness, yeah, good for you.
Yeah.
Yeah, insight meditation for folks listening, and also there's a lot of meditation centers where they have courses and so forth. So if people want to learn, it's more of a mindfulness, compassion base. It's based on Vipassana, so that's a really good.
I love that.
There's a great one in Seattle, actually, Sarah, Insight Meditation Center of Seattle, kind of by like football field and stuff. But anyway, we're getting off topic. So let's kind of, we have one final question here. On one of your blogs, I think you have 2 sites. One of them wasn't like, what is my elevator pitch, right? So the question that we ask every guest is, if you were to bump shoulders with a president of a foreign country or the United States or someone from the World Health Organization and just had 30 seconds to share with them a powerful health tip, what would that health or wellness tip be and why?
I would say start noticing your nasal breathing. Do you breathe through your nose or your mouth? That's probably the best thing that you can do, is try to figure out that breathing thing. It's crucial.
Yeah. Sarah Hornsby, really appreciate you coming on the show. And if folks want to learn more about you, what's the best online resource where they can kind of follow you and your work?
Well, we actually just came out with a new website called sleepapneatherapist.com, and that's going to be a really good way to find me. My standard website that everyone finds right now is myfaceology.com, and you can find me on Twitter at Sarah Hornsby RDH, and you can also find me on Facebook at Sarah Hornsby RDH. And I offer free Skype consultations. One of the things we didn't actually talk about was I see all my patients online. So I have people that I work with from all over the world, 13 different countries right now, and everything I do is on a screen. So I'm not always face-to-face with people, although I used to do that all the time. Now I do everything over Skype, FaceTime, that kind of thing. So,
that's awesome.
Yeah, so
people
contact
can see
me.
you anywhere in the world,
exactly,
which is really fantastic.
You can live anywhere. You don't have to be in Seattle. Like I said, I see everyone online, even my Seattle people.
Right.
So the best thing you can do if you're interested is get a 30-minute free consultation with me, and I can tell you what I see. I can answer your questions. From there, in order to get treatment, we have to do a full evaluation, which is $75. But the 30-minute is a great way to start, and a great way to get to know me and kind of just find out, is this, do I have this in my child? Do I have this in myself? And I'll tell you what I think. Yeah,
I mean, I think I would recommend this initial consultation to anyone who wants to improve their sleep, which is everyone that wants to live a healthy life. So I think everyone should do this because, just like in school, we're not taught about finances, about the microbiome, about eating well. We're not taught about the importance of nasal breathing for our health and sleep. So I commend you for doing this work and sharing this message, Sarah. And if folks are listening right now on iTunes and they want to check out the video version of this interview, I posted that on the blog at highintensityhealth.com/146 for episode number 146. So I appreciate you coming on the show. Thanks for tuning in, everyone. We'll catch you on the next episode.